patient who had dengue fever. Now this patient is in the recovery phase. The fever has settled and the classical mottling rash of dengue has started appearing in this patient. And another important thing you see, there are certain bruise marks on her arm. These marks are at the place when the blood pressure cuff was applied and it was inflated. The pressure of that resulted in bleeding under the skin. So this is a seen in dengue, and you see one of the tests when the platelet counts are not available, you can go for this tourniquet test in which we inflate the blood pressure cuff between systolic and diastolic pressure, and for 5 minutes we keep the pressure between the systolic and diastolic pressure, and then you release the pressure, the blood flows into the distal area below the blood pressure cuff, and there is appearance of petechial rash. So you note an area in the forearm where there is no rash, and then you apply that blood pressure cuff, and then you release it after 5 minutes. The blood gushes into the vessels, and there is appearance of petechial rash. So this is how we do a tourniquet test. So this patient anyway shows there are certain bruise marks, linear bruise marks in the arm. That was the place where the blood pressure cuff was applied. So this is seen in patients who got dengue fever. And as the rash appears, there may be pruritus and it shows the signs of recovery. And at this time, some of the patients may go into the critical phase, that is, there is capillary leakage of fluid, and you have to be very, very careful. These patients require strict monitoring of their hematocrit and the vitals, including pulse, blood pressure, the peripheral perfusion measured by the capillary refill time, and urine output. So this is a case of healing patient with dengue infection.